The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. Good day to you. I am Tony Urbanic, and this is TMD Demystified. Today, we will be talking and continuing the thought process to answer the patient's question about the use of a very simple device that fits in the front of the mouth, behind the front teeth, which separates the back teeth, unloads the joint like a set of crutches would unload an inflamed knee, and removes or decreases all of the symptoms involved with TMD. The question that the patient asks, and we'll be talking about and trying to answer, is how come nobody ever told me about this? So unfortunately, we had to call this device and protocol, the use of the device, the Urbanic device and protocol, because I could not come up with a better name. Our patients wanted to call it the miracle device and the save my life device, and I just thought that was too kooky. And I couldn't think of a more selective, simple, concise word or phrase to use, so I just fell back on the Urbanic device, unfortunately. In any case, the most common question we get from patients after we do a consult and they get down the road a little bit in the process of limiting or ameliorating or decreasing their symptoms is, how come nobody told me about this? I've had this problem for 10 years, 20 years, 30 years. And so this is the 7th part in a 10-part series, I believe. And we're going to discuss the patient's role in answering that question. Why has nobody ever told me about this? Now, we've already covered insurance companies, teaching institutions, hospitals and large corporate health groups, venture capitalists, government, and physicians and dentists. I put physicians and dentists in the same group, but actually it's quite different as to what their level of responsibility is, why the patients have not found out or have no knowledge of or can't find out about a simple device that takes away all the symptoms. I say this cautiously. I make these comments cautiously. I know how to some of you this might sound. It is quite a statement, but I stick by it because of our statistics, because of our study, which proves it, because of the over 4,000 patients who have used the device and gotten substantial, and I mean substantial, in the 90% relief range of their symptoms, 90 plus, 95 plus. Frankly, the only people that we really can't help are people who, for one reason or another, will not follow the protocol or do not return for follow-up appointments to take them through the process, because it is a protocol and a very simple protocol. However, and again, unfortunately, the next level or the next category of people who have responsibility to answer that question, how come nobody ever told me about it, are the patients themselves. And boy, do I open up a can of worms when I make that statement. I am not trying to say, and I will not try to say, that the patients are responsible for their own problems. But yet there are some factors with patients as to, if they did things differently, if the patient's thought process and actions did things somewhat differently, they would have a better chance of finding out a very simple solution, because simplicity is not what doctors want to do. And of course, simplicity is what patients want to do. They actually don't even want to go to the doctor if they didn't have to. So let's go down a few points. I think this is going to be a rather short presentation. And I go into this with some caution, because it's really hard to say that patients are responsible for their own problem. But yes, we do know, though, and this does not fit this particular category and not what I'm trying to say, but when patients don't look after their own health, if they eat too much, don't sleep too much, wear themselves out, take drugs and alcohol, do things that we know are detrimental to the health of the body, patients are responsible, and they are responsible to do those things. But that is not what I'm driving at when it comes to TMD. So I have 4 categories that I'm going to briefly talk about, and then we'll just leave it at that. Again, this will probably be a short presentation. But the first thing is, how come the patients don't know about this? And that is, number one, they trust their physicians, their doctors, their dentists. Sometimes too much, frequently too much. Us doctors, and I hold the union cards in both dentistry, medicine, and academia, I am well aware that doctors don't know it all. And some doctors don't take their oath of do no harm and Hippocratic oath not seriously. But I think that it is safe to say that patients trust their doctors too much. They don't ask enough questions. They don't investigate, not necessarily the doctor. I mean, you can investigate your doctor all you want, but investigate their symptoms, investigate their problems, and use their common sense rather than just walking in an office. And as I've mentioned many times, not in writing and not in public, but to my staff, patients, enter our office, sign in their name and register, and their whole concept is, I'm here, fix me. It's like, I have nothing to do with it. Now, that's the wrong attitude for a patient to have. They need to certainly have trust when trust is built. When your doctor or your provider of any kind shows that they can actually produce what they promise, that develops trust. And I totally agree with that. And if your doctor of any kind consistently produces what he promises, then you should trust him, her, for sure. But I think that it is safe to say that too many patients trust their providers too much. The next is kind of similar, and I've kind of touched on it, but patients rely on doctors too much, too frequently, to greater degree for information about their health care. It's your body, Mr. Mrs. Patient, and with the internet and with all the information available to us now, it is safe to say that it is reasonable for any patient who has a symptom, has a problem, who kind of concerns themselves about whatever. There is so much information to be had. The problem is, of course, the patients don't know what to believe. Again, it gets to trust and belief. And as we well know, there's a lot of information on the internet which is not trustworthy and is not believable. So that's where patients have to crank in their common sense and their critical thought process to determine, what makes sense to them. This brings out a point. When I and my associate, Dr. Urbina, do consults in our office here, and we get into the consult at some point, or maybe at the end of the consult, frequently we hear from the patient, oh, that makes sense to me, what you'd explained, how it works. It makes sense to me that inflammation creates all these symptoms as you explain it. That makes sense. That's what was happening to me. Oh, that makes sense. And that is the process that I think everyone, doctors and patients, should use. It's called critical thinking. Not to criticize, but to think critically of what you hear and understand. You do not have to be a doctor to think critically, to see whether what you're reading makes sense. And of course, some of this stuff that is published, unfortunately, and of course, in the scientific papers, patients aren't going to understand that unless they themselves have some level of science training or a scientist. But there is enough, and as I well know, as I read the internet, there are a lot of sites that boil down scientific data into language that patients can understand it. So, number two, patients have some level of responsibility on their own problem by relying on doctors and not relying on their own level of critical thinking, and to investigate the information that's out there. Because we all know when it comes to TMD, there's a lot of smoke and mirrors. And we all know that nothing historically has worked, including surgery. And I will attest to that. Pretty much the only thing that's left in the surgical realm right now is when everything goes south and nobody else knows what else to do, and the joint is totally destroyed, then there's total joint reconstruction, which I've done more than my share of those operations. And I know how difficult they are and how fraught with potential complications they are, and potential consequences and unintended consequences of those operations. But that's part of why I decided years ago not to do any more TMJ surgery at all in my surgical career, and went on a different path to try to figure out. Didn't know I'd figure it out. Wasn't sure I'd figure it out. Didn't know that the solution was so simple and that it was non-surgical. But my patients, the story is out there. You can go back to other episodes and read it, listen to it, how I found out by direction from my patient where to look. Patients, quote, plural, where to look. I heard it so many times. And basically they said, if I put my finger between my front teeth, it feels better. That's where it all started. And I learned from that. I investigated from that point. And then I investigated, once I learned it worked well, how it worked, why unloading a joint, and then it all fell into place. This joint's like any other joint. However, patients do have some responsibility. Next point on my list here is patients only follow up on their health care when they have a significant symptom, or a symptom that they feel is significant. And that is, their responsibility to follow up and to look into the issues with their own body. And the body speaks to you. You all know that. As I get older, my body really speaks to me in many different ways, and I deal with it. Unfortunately, I have a lot of scientific knowledge, and I usually understand or can figure out what's going on and take appropriate measures, whether it be through assistance from a colleague or assistance through investigation. But the point is that, I, as an individual, try not to just only try to find a solution when it hurts or I have a symptom. And unfortunately, the symptoms of TMD come and go, and everyone agrees on that. That is the consistency of temporomandibular joint symptoms of all kinds, that they're sporadic and they move around. They don't all come to the same place. So it's unlike a toothache. You can point to the jaw, you can point to the tooth, and you walk in the office and say, it hurts right here. But when it comes to TMD, the symptoms are quite different depending on what's going on with the inflammation and how it is interpreted by the central nervous system, and creates all these other symptoms, and it stumps the other doctors and stumps the patient. But the point is that they only go to seek help when it hurts and does not follow up when it doesn't hurt. And I can emphasize that and have great knowledge of that particular point, in that, we do consultations, and, after a while, the patient goes into a area where the symptoms are come down, and they don't seek treatment until they come back again, and they will be back in your office, again, seeking treatment and saying, well, I thought the problem wouldn't come back. And as I know, and I tell patients all the time, no, this is a cyclical problem. It doesn't come back. It only gets worse with time, but the symptoms do cycle. And why do they cycle? Primarily, there are other reasons, but primarily they cycle because of hormonal cycles, primarily estrogen, because it's primarily an estrogen associated problem. Estrogen exacerbates inflammation. So yes, with the females, and you can actually time most of the patients, not many, most of the patients, the cycles are timed with their menstrual cycles, and the symptoms become very obvious and in many patients, young females, very obvious and grievous when they start their menstrual cycles. Estrogen exacerbates inflammation. So, that is on the patient. How come nobody ever told me about this? Because they didn't do, their follow-up, and just kind of blew it off and waited. Hopefully it wouldn't come back. And then the fourth one is kind of built on the other three, and that is lack of investigative nature. And as I've experienced, very, very few people, unfortunately, have an investigative nature about their own health. Of course, there's so much available. I've never seen so much. I can't believe the number of articles and sites and webinars and blogs that are now directed toward every conceivable issue of healthcare that is obvious and available for patients. And so if a patient wants to investigate it, it's there, but most patients do not. The vast majority, in my opinion, this is an opinion now, do not have an investigatory nature about their health care. My daughter is an executive with Nissan, marketing executive, and through her I know a lot about the automobile business, and I can tell you that people investigate how to, when, how much, and what issues that come up about buying a car than they are willing to investigate their own health care. So, it's just the way it is. And so I speak with some authority, lots of experience on this issue. It's not to denigrate the patient, and I'm certainly not saying that really the patient is responsible for their own problem. No, the patient is not responsible. They have no control over their clenching and grinding of their teeth. A lot of people think they do. There's something wrong with them because they clench and grind. We do not understand the mechanism of bruxism. We know that stress, anxiety brings on bruxism. That is the only thing we know about it. But once that stress anxiety is there, which is a mental thought process, how that converts into grinding your teeth, we know where that's happening. We know it's happening in the brainstem of the central nervous system. That's where it's all going on, but we do not understand it, how that converts. And I tell patients that all the time. So the patients have no control of that, and they are not responsible when they have a motor vehicle accident, unless they cause the accident. But, they have an accident, the airbag slams their jaw, or they have whiplash, and that creates inflammation and acute damage, which goes into chronic inflammation and creates TMD symptoms or functional malocclusion. They aren't responsible for how their jaw grew as they grew through childhood and adolescence. So they did not create this problem for themselves, but they are responsible for some things that they could do, should do, to answer that question. How come no one ever told me about this? They have to share a little bit of this responsibility, and that's what I'm talking about. I'm trying to put all of this in perspective for you, the doctors, who I assume it's doctors who are watching this primarily. I hope so. Dentists primarily, of all varieties, especially the doctors in our current and growing network of doctor providers who provide this service that I mentioned, you know, the Urbanic device and protocol, which is highly successful in relieving all the symptoms. But I want to paint an accurate picture, a total picture, to help you through the thought process of my involvement in my thought process over a period of years and the things that I've learned, experienced, and really understand about this problem. And in this case, trying to understand the patients themselves who have this problem. These patients are not crazy. I have been told so many times by my colleagues, don't get involved with TMJ. These patients are all crazy. No, that is absolutely insulting to the patient. It's insulting to the patient. It's insulting to the doctors who want to get involved, because we know they're not crazy. The symptoms, until recently, have been unexplainable, and the patients are mostly upset and confused. And my job is to try to demystify for both the doctors and the patients this problem. And once it is fully understood, and once the full simplicity of it is understood, then it's not going to confuse anyone. Then we'll actually, develop a broad knowledge that will go fairly rapidly then through the dental industry. Now we're just beginning to get the word out, except in Middle Tennessee, where we now have over 850 referral sources of my colleague doctors, physicians, dentists, chiropractors, PCPs, et cetera, nurse practitioners who do understand the simplicity of treating TMD and refer as patients. I want that to happen to you in your neck of the woods, where you live, people that you serve. The same thing is easily available to you also. With that being said, I want to wrap it up. I look forward to the next time we will talk. We will continue on to the next part of this, answering this question: how come no one ever told me about this before? I am Tony Urbanic, and this is TMD Demystified.